Suppose you suffer from high blood pressure and find your pulse rapid or irregular. In that case, your doctor will put you on a beta blocker with other antihypertensive medication to protect the heart from a second heart attack after a first heart attack. They are also called adrenergic blocking agents that reduce blood pressure. They work by blocking the effects of the hormone epinephrine, also known as adrenaline. Now, what is the function of adrenaline in your body? Adrenaline is a hormone released from the adrenal gland that sits on your kidneys. When you are stressed or in frightful situations, the adrenal level in your blood is raised. That makes your heart beat faster and your lungs breathe more efficiently. It helps your body react quickly. Beta blockers seem to slow down this action and keep your heart working within the normal range, bringing down the blood pressure. These heart-slowing drugs are called beta blockers because they block the beta-1 receptors predominantly found in the heart, kidneys, and fat cells. The drugs that belong to the category of beta blockers are acetylbutyrol, atenolol or tenomine, bisoprolol or Zebeta, metoprolol or Lopressor, nadolol or Cordage, nebivolol or Bisostolic, propranolol or Inderal. If you are on any of these drugs, this talk will help you understand how they work for you and the possible side effects. They are not prescribed for high blood pressure as a first treatment in people who have only high blood pressure. Beta blockers aren't usually prescribed for high blood pressure unless other medications such as diuretics haven't worked well. Also, a doctor may prescribe a beta blocker as one of several medications to lower your blood pressure. In uncomplicated high blood pressure, the drugs of choice your doctor will prescribe are ACE inhibitors or angiotensin receptor blockers, which I have discussed in a previous YouTube. Beta blockers are prescribed with amlodipine or nifedipine, drugs classed as calcium channel blockers. These act by affecting the movement of calcium into the cells of the heart and blood vessels. They relax blood vessels, lower blood pressure, and increase supply of blood and oxygen to the heart while reducing its workload. When excess calcium accumulates in the blood and is combined with cholesterol, it has a devastating effect on human health. It forms plaques that adhere to the walls of the arteries. These deposits can cause partial or complete blockage. It also hardens the walls of the vessels. So, remember that calcium channel blockers relax the smooth muscles of your heart and blood vessels and bring down the blood pressure. Your doctor may have prescribed a calcium channel blocker with other antihypertensive drugs for your high blood pressure. As said before, beta blockers are used with calcium channel blockers. Certain varieties are not advised. For example, verapamil beta blocker will not be given with diltiazem calcium channel blocker. Please check your combined therapy for high blood pressure, and if you are on the above combined medication, you need to clarify with your doctor. In summary, beta blockers are used to treat high blood pressure and irregular heartbeat like atrial fibrillation, help prevent future heart attacks and strokes, and prevent chest pain caused by angina. All beta blocker drugs are used in addition to lowering your blood pressure to treat anxiety. Propranolol or Inderal is the drug that has been most studied for anxiety. Atenolol or tenomine or metoprolol are the other beta blockers prescribed for anxiety. Beta blockers are given to treat the overactive thyroid gland. Propranolol or Inderal is the most popular beta blocker for the overactive thyroid gland. These drugs are not prescribed if your blood pressure is low or in heart failure, diabetes, liver and kidney problems. You must never take any beta blocker if you have asthma or pregnant mothers and when breastfeeding. Beta blockers like propranolol are prescribed for migraine headaches. Now let's discuss the side effects of beta blockers. Commonly reported side effects are feeling tired, dizzy or lightheaded. These can be signs of a slow heart rate. Cold fingers or toes. Beta blockers may affect the blood supply to your hands and feet, difficulties sleeping or nightmares. Those who take beta blockers are more prone to get chilblains during the winter months. Long-term side effects include disorientation, short-term memory loss, emotional liability, rapid extreme changes in mood, inability to concentrate or think clearly. Weight gain is a side effect of beta blockers. Certain foods you need to avoid when you're on beta blockers. Caffeinated foods and beverages, including coffee, energy drinks, energy bars, and certain sodas, can also interact with beta blockers by slowing down how fast your body metabolizes them. This can cause the medication to stay active in your body for longer. It is dangerous to stop taking beta blockers suddenly, even if you are experiencing side effects. When you take beta blockers, your body gets used to heart's slower speed. If you stop taking them suddenly, you could increase your risk of a severe heart problem such as a heart attack. So viewers, I hope this video presentation was helpful. It is essential to know the workings of the medications in your body that you take prescribed by your doctor, or a more rational way of treating your medical issues. Stay safe and suitable. Goodbye for now.